Is Movember, and every November the focus is on men's health. And one of the most diagnosed cancers in men, prostate cancer. There's a clinical trial now underway for advanced prostate cancer at Hartford Healthcare Cancer Institute. And joining us is Principal Investigator Dr. Christopher Iannuzzi at St. Vincent's Medical Center. Doctor, welcome.
Thank you for having me. Good afternoon.
Great to have you. So before we get into the details of the clinical trial, what does it mean when prostate cancer is advanced?
So we refer to that as what we call high-risk prostate cancer, and it's usually men that have either a very high PSA of greater than 20, or if radiographically we see that the prostate cancer is growing outside the capsule of the prostate, or if when we look at the cancer under the microscope, there's a lot of cell turnover, which suggests that it's very aggressive.
All right, doctor, tell us more about your clinical trial. What are you looking into, and how will patients benefit?
So for patients who have high-risk prostate cancer, if they don't have surgery, the standard of care these days is that they get 2 years of what's called hormonal suppression plus radiation therapy. And hormonal suppression is lowering a man's testosterone because testosterone is the natural food supply for prostate cancer. So in essence, we make the body an infertile ground for prostate cancer. And we recognize that this is a large group of patients, and some men may need less than 2 years of hormonal suppression, and some may need to intensify that hormonal suppression. So what this trial is in essence trying to do is really tailor the treatment to the particular individual.
All right, that's the future. We hear that all the time. You referred to the Cipher Score. What is that?
Yeah, so a Cipher Score is something called a genomic assay. So what that is we actually look at the cells in the prostate biopsy specimen. We're looking for a set of genes that control cancer growth. Based on the expression pattern of those genes, you actually get a score. That score gives us some indication of whether the overall cancer is slow growing or fast growing. If it comes back as slow growing, we treat these patients with less hormonal suppression, and if it comes back as fast-growing, we treat these men with more hormonal suppression. So think of this as sort of personalized medicine, tailored treatment to the actual tumor cell.
All right, and doctor, so tell us about the background behind this. What were you seeing that led up to this advanced prostate cancer clinical trial?
So what we notice is that this group of high-risk patients is what we call heterogeneous. So there's a lot of different patients that make up this group. And instead of trying to deliver the same treatment to all of these different patients, we really prefer to give less treatment where that's indicated and more treatment if it's indicated. So again, really trying to personalize the treatment to the individual.
Okay, and 30 seconds for this last question. Who's eligible? Who can fit into this high-risk group?
So again, anybody that has a PSA greater than 20 or have what's called a high Gleason score where the cells look angry under the microscope, or if the cancer is growing outside the capsule of the prostate, they may be eligible for this trial.
All right, Dr. Christopher Iannuzzi, thank you so much for joining us. We appreciate the information on your trial.
Thank you very much for having me.
You're welcome.